So in the medical field, there is a lot of things that we have to deal with, of course, and COVID-19 is just another one of those things that we have to deal with. It's going to be here for a while. Now there's cases already in the United States. Now worldwide, we know there's been over 90,000 cases that we know about, and about 3,000 deaths already from that, which is very typical of what you see sometimes with the flu. You're going to see a lot of deaths. We just don't report them as often as we are reporting this now in the news. I think that they have been doing a very good job as far as trying to contain the virus, but you can see that even with all the efforts that they've done to try to contain this virus, that it's very hard to contain a virus because it spreads so easily. And because it does spread so easily, we have to be vigilant and we have to be careful. So let's talk about parents first of all. Parents, if you have small children, don't take them to places where they can come in contact with a lot of ill people, people that can be sick, people that are coughing, sneezing, runny nose, anything that looks like they may be sick. You have to be careful. Not only because of this virus itself, COVID-19, but we worry about influenza, we worry about other virus infections, and we know that little children, their lungs are smaller, their tubules, their bronchioles are smaller in their lungs, and because of that, they can get worse symptoms, like they do with RSV as well. So they can get very bad symptoms, they can be hospitalized, and we just have to treat their symptoms at this point, because there is no treatment for this. So we have to be very careful with the small children. Parents also, and everybody else, make sure you're washing your hands. The CDC recommends washing your hands for 20 seconds with soap and water, making sure that you're not rubbing your nose, rubbing your eyes, and I would limit the handshaking as well. You know, when we always, in this country, we shake hands all the time, and it's very common. But at this point in time, you have to be very careful how you're doing it. If you do shake hands, make sure that you're sanitizing and cleaning your hands often. Hand washing is really, really important as well. Think about the things that you're touching around you. We tend to just live life with not worrying about things like that because we touch everything around us, but we have to limit and know what we're doing, know where we're going, know what you're touching, and then not rubbing your eyes, making sure you're washing your hands afterwards. The disinfecting your house, disinfecting areas is very important as well. Make sure you're cleaning up things well so that we kind of get rid of possible contamination around, especially if we find out that there is a person sick and they do have a virus. Then we have to make sure that we're cleaning the areas very good with disinfectants so that we can make sure we minimize the chances of somebody else getting sick as well. Let's move on to elderlies. Now, elderly people, older adults, or people that have their immune system compromised for whatever reason, because they're taking medications for rheumatoid arthritis, or because they're sick, or taking anti-cancer medications, or treating with any type of medications that may decrease your immune system. You have to be very careful and cautious as well. Take more precaution because of that. Make sure you're not around ill people. Make sure that you're washing your hands well. Use your Germ-X and clean your hands well as well. And we have to make sure that the people that are sick, that you're very respectful of others. It's not so much about you being sick, because if you're a healthy adult, you may do well having this virus, but there may be people around you that are not going to do well, and those are the people that we have to watch out for and take care of. So make sure that you're seeing your doctor and know that you're gonna have to possibly be tested for this virus or flu or something else that you might have, so we can figure out how to best treat this condition that you have at that point. Let's go on to physicians. I think as physicians, what I'm trying to do is making sure that I'm advising my people, knowing that the virus is already in the United States, not very widespread, but it's here and it's very hard to contain. As we know, there may have been a case in San Antonio that was a person was let go and actually tested positive. So now there's some people being watched in San Antonio as well. So because it's very hard to contain, and we need to warn and advise our patients that if they do get symptoms of a runny nose, shortness of breath, cough, fever, any symptoms like that, to make sure that they're advising us so that we can try to give them good recommendations as far as testing or sending them to whatever clinic we need to send them to get checked, so that we can stay on top of these symptoms and we can minimize the amount of people that are going to get sick. So I think together we have to work as a team. Everybody in the medical community and everybody in the public needs to work together so that we can try to minimize infections. And this goes not only with this virus, it goes with any virus, with any infection. We have to watch out for each other. And I know there will be other infections to come after this that we also have to deal with. And I think the more we prepare ourselves, the better. And the best way is making sure that everybody is aware and educated and everybody is doing the precautions that are necessary so that we don't spread infections too fast. Hopefully we can get the cure for this and fight this virus faster than what we've dealt with other things in the past. And the vaccine will take some time to come out, maybe a year and a half possibly. As far as treatments, they're studying many things, many medications at this point. So there is a lot of studies that are already started so that we can try to figure out what is going to treat this the best. There's medications that are from HIV medications to malarial medications. So there's a lot of different studies that are going to be going on. Hopefully we'll find something that actually works pretty well. I'm not sure when that's going to be, but hopefully as soon as something comes up that is actually treating patients and they're doing very well, then that's what we're going to go to in the meantime. For now, we have to just limit the virus as much as possible so that we're not exposed. For White Coat Medicine Talks, this is Dr. David Cruz. Like and subscribe. Please share this video with everybody. I want everybody to be safe out there. Take care of yourselves. Don't panic like the stock market did, but just, take care of yourselves. Take care of everybody around you as well. Like and subscribe. We'll see you later.